this individual
This
was
is Antigua
identified in a
breaking news.
traveler who traveled from the person who traveled from the United States, and the person is no longer an active case, and they're no longer in Antigua and Barbuda. So no, it's not one of the current
This
active
is
cases.
Antigua
My
breaking
concern is
news.
that this tells us that, as we expected, the Delta variant is now in Antigua. Yes, we picked it up in this one sample, but it doesn't mean that
This
it's
is
not
Antigua
circulating. So
breaking
persons
news.
have to be extremely careful. As I would have said in the press release, it's the Delta variant has increased transmissibility. In fact,
This is Antigua breaking news.
compared to the other variants of concern and variants of interest. So yes, very, very concerned that although we picked it up in this sample, it could be circulated in other
This
persons
is
in Antigua and
Antigua
Barbuda.
breaking news.
Please stick to or adhere to the measures we've put in place, the wearing of the face mask. They have been proven to reduce transmissibility. And when I say wearing a face mask, wear them properly. Make sure they securely cover your nose and mouth. Wash your hands properly. Remember physical and social distancing, and physical distancing is staying at least 6 feet away from another person. Social distancing, avoid crowds, avoid going to social events, because those are situations where the transmission of COVID-19 is increased. Vaccination. It has been proven that the preliminary evidence indicates that twice the rate of hospitalizations for unvaccinated persons, right? So persons who are unvaccinated place themselves at a higher risk of becoming infected with COVID-19, of becoming infected with this Delta variant. So they are urged to get vaccinated. Vaccination sites are available at the Multipurpose Center and at the Villa Polyclinic. We have 2 vaccines currently available, the Sinopharm and the AstraZeneca. Please, please, please get vaccinated to protect yourselves, your family, your loved ones. So we have the capacity now at the Sir Lester Bird Mount St. John Medical Center to detect variants, so we'll continue to do that. We've asked the Caribbean Public Health Agency, CARPA, for us to increase the number of samples that we could send on a monthly basis for variant identification. So that is going to enhance our surveillance capacity. So as we get samples, once we meet the criteria, there's certain parameters that would make a sample eligible for variant testing. Once they would meet that criteria, we would send them off to CARPA, and hopefully we will be able to detect no more variants, but I think that we will, given the transmissibility of the Delta variant.